Hi, I'm Jennifer Harrington, Senior Naturopath and founder of Parramatta Naturopathic Clinic. Today we're talking about biocompatibility testing, and we have special guest Dennis Hodges from Naturopathic Services here to help. Welcome, Dennis.
Thank you, Jennifer. Great to be here.
So what actually is biocompatibility testing?
Biocompatibility testing is a term or a name we've given to our hair analysis program. What we do is take a little sample of your hair, and from that we determine compatibility. So we develop this equipment to test which one is right. So for one person, this one could be perfect for me, but it could be bad for you, or vice versa. So when we feed the body right, then it's working on the immune system, which then can repair the body. So it's a very, very different process, because we're not working on what's good for you and what's bad for you. We're working on what's right for you.
Dennis, can you briefly tell us how you became involved with biocompatibility testing?
I started in practice in 1985, which is a long time ago. And in those days, I thought I was reasonably good at my profession and at diagnosing, prescribing and whatever. But I found a lot of my patients were rebounding. They'd come, fix their asthma or their sinus and things with arthritis, we'd clear it all up, but then 6 months later they'd be back again. So like I was saying before, it's like we're not getting to the cause of the problem, and the naturopathic philosophy is always we don't treat disease, we want to know what's going wrong in the body, and we work at that lowest level that we possibly can.
How much hair do you need to do the test?
If I could just demonstrate on you, I'll just show you a little bit. Well, you've got plenty of hair here to demonstrate with. Yeah. So we only need like about that much.
Oh wow, that's nothing.
So it's not much, and it's so it's great for people with short hair or long hair. But
my hair's coloured. Does that matter?
Very rarely do people react to hair colour. So as a general rule, we say no. We take the hair sample, and with each hair sample we test it first to see if they're reacting to the hair colour. So if it's okay, we just go ahead. If there is some sort of reaction there, then we need to get some hair from elsewhere on the body that isn't coloured and go from there.
This leads me to another question. What if I don't have any hair?
We can take it from other parts of the body too.
How long does it take to get the test results?
We get the results back to the practitioner in about a week. But the program really starts from when we take that hair sample, because part of the program is for the clients to fill out a meal diary. So for that first week, while they're waiting for their test results to come back, they're writing down everything that they eat and drink, the brand names of all the products and things that they're using, and they will bring that back to you, the practitioner, at their first consultation, and then you can use the test results to fix up their diet and get them eating everything that's right for them.
You mentioned a 6-month wellness program. Do I need more consultations during this time?
Well, initially there's the initial consultation when we take the hair, a follow-up one at a week or 10 days later to get all the test results, and then we usually like to leave them do that for 4 weeks. So the next consultation is at 4 weeks. If they're responding very well, some of them you don't need to see until the end of the 6-month program, but that's between the practitioner and the client at that stage, because as you know, some of these people have many, many symptoms, and some of their disease states are quite complicated and need other medications as well. So, but initially 4 consultations will get them well and truly on the way.
How soon shall I start to see the results?
Common denominators with all disease states is inflammation. So it takes about a week to 10 days for the inflammation to drop down, and then by the end of 4 weeks the repair process has started. So we get some people who, some of their symptoms can clear up in 3 days. Others it will take 3 weeks or 4 weeks. Then we get some of the people that it might even drag on to 6 weeks. So it's very, very individual, because the good thing about this program is we're allowing the body to heal the way it wants to heal. We're not forcing anything, and if a person presents, say, with headaches, the headaches might be the first thing to go, or they could be the last thing to go.
Thank you very much, Dennis, for coming in today. That was very interesting. If you'd like any further information on biocompatibility testing, you can contact the clinic directly. Good night.